So much for inviting us to talk about our project at this Lunch and Learn. The title of our project is Feed, Read, and Grow, a multi-agency effort to improve access to healthcare, food, and literacy resources. My name is Harsha Bhagtani.
And I am Natalia, Jaimes.
We have no disclosures. However, the Feed, Read, and Grow program did receive Carilion Children's Foundation grant. Our objectives for today are:
explain the definition and importance of community pediatrics,
discuss the pediatrician's role in community pediatrics,
to introduce our collaborative partners,
outline the Feed, Read, and Grow project,
and to invite you to contribute to the project.
Community pediatrics, as defined by the American Academy of Pediatrics in its policy statement, is the practice of promoting and integrating the positive social, cultural, and environmental influences on children's health. We know that the biological, behavioral, social, and physical environments greatly influence child health, and the major threats to children's health cannot be addressed in the clinical setting alone. Threats such as high infant mortality, obesity, exposure to environmental hazards, substance abuse, poor school readiness, and inequitable access to resources. The role of the community pediatrician is to merge traditional clinical skills with public health population-based approaches to practice and advocacy. It includes participation in community-based child health activities in partnership with other community leaders.
Our community partners are, first of all, our patients and their families who inspire us daily and who have a representative in our meetings.
Carilion Children's, our physicians, residents, nurses, dietitians, therapists, and staff who also inspire us every day.
Virginia Tech, the librarian, Virginia Tech Carilion School of Medicine students, Virginia Tech Spanish classes.
Roanoke Public Libraries, the main libraries are pilot.
City of Roanoke Department of Social Services.
Roanoke City Health Department, specifically WIC program.
United Way and Local Environmental Agriculture Project, LEAP.
Feeding America, Southwest Virginia.
Child Health Investment Partnership, or CHIP, of Roanoke Valley.
Joy Neuron.
Blue Ridge Literacy.
Physicians to Children.
YMCA, and many people in the community who have joined us in this effort to educate and help our children.
Feed, Read, and Grow has 3 branches. The first one is the medical home, the second one is food insecurity, and the third one is health literacy. The medical home branch of this project actually started when we noticed a problem that our patients did not have insurance. In investigating further, we found that the insurance application help that they were receiving in the hospital nursery, they were no longer getting due to budget cuts. Our patients did not know how to apply for or renew their insurance, and therefore families that qualified for insurance did not have it. We actually partnered with the City of Roanoke, both the Department of Social Services and the Public Library System, in order to come up with a solution.
Our solution was to put a social worker initially at the library on Wednesdays. And that worked so well that we actually started putting somebody again in our Jefferson Plaza office on Thursdays. And this has been a wonderful thing for our patients because now they have somebody they can talk to. They were before asked to call or do their applications online, and that is not an easy task for our patients who have very low literacy and who speak other than English. So this has been a really important part of this collaboration has been really important. Dr. Steve Griffin took this as a QI project, and he developed smart phrases to put on the ABSs for referring our patients to the DSS worker, and that was in English and Spanish.
We would like to thank the Carilion Children's Foundation for money to expand the project since this pilot was so well received. Our patients loved it because they actually had a human being they could talk to about their problems. Our providers and residents really loved it because they could refer our patients to DSS in our office or at the main library where they could meet with them. And then the DSS folks really loved it because they were able to see patients in an environment that was considered very friendly, both the library environment as well as our office environment.
They're not only helping to apply their applications for Medicaid or renew their applications for Medicaid and Medicare, but they're also helping with other needs that the families have, like food stamps, temporary assistance for needy families, and energy bills. So they actually help not only our patients in Jefferson Plaza, and it's very important for us to get this, is also everybody in the community, not only for children, but any ages. So they are there for you. The person that you can contact for details is Jennifer, and we have put her name and her phone number in this flyer that you got in your previous emails.
The food insecurity branch of the Feed, Read, and Grow project actually started when we started noticing that our patients were screening positive for food insecurity in the office setting when we did the hunger vital signs screening. This actually upset all of our providers and our residents because we were very worried that our patients were not able to get food on the table. We partnered with DSS, WIC, United Way, Feeding America, and the Roanoke Public Library System to kind of see what were available resources for our patients that screened positive for the test.
We had a food pantry list that was actually developed by Dr. Ahmed and Dr. Fulton in prior years, and we shared these food pantries with the library, with the Roanoke Library, and then they also shared with us what they had for the patients already. So right here you're going to see who's partnering with us for food insecurity. We're very happy to actually have found information that could be useful for many of them. For example, here we have the Feed and Read program where they can feed our patients from kindergarten to 12th grade in the Belmont Library, Gainsborough Library, Main Library, Melrose Library, Raleigh Court, and Williamson Road Libraries. So they do it Monday to Friday, 3 to 5 p.m., and Monday to Thursday for snacks, 5 to 6 p.m., and then Saturdays they also give them a dinner, 12 to 2 p.m., and snacks, 2 to 4 p.m. So if you know of your patients that need food, this also is an alternative.
The health literacy branch of the Feed, Read, and Grow project actually started with the problem that in our offices we had many non-English speaking patients, as well as a lot of our patients had a low literacy level and a very low health literacy level. And we were very worried that the instructions that we were giving to our patients, they may not understand or really fully understand what was going on. And so we partnered with the Blue Ridge Literacy and the public library systems, along with our community leaders such as Joy Neuron, CHIP, WIC, YMCA, and teachers in our area in order to come up with a solution for this issue.
For this solution, we have three different answers. We have the Pediatricians Corner, English as a second language, and health literacy classes, and educational workshops. So expanding a little bit more about that, the Pediatricians Corner is pretending to be a patient resource center. We're going to pilot in the main library. And what we want is books, videos, apps, articles, books for kids and also for the parents of things that as pediatricians we think are pretty useful for the parents to have. So we give the list to the main library and they're going to get the books for us so our patients can borrow them instead of having to buy them. So this is a resource for them. The Blue Ridge Literacy, we are helping us with English as a second language. They do have English as a second language classes for in the mornings, around noontime, and also in the evenings, so our patients who work can have different alternatives to be able to educate themselves in the English language. They also have citizenship classes, and they got a grant for health educational curriculum that we're very happy to now get our students on Virginia Tech Carilion School of Medicine, medical students who actually work with the refugee partnership as volunteers, working with them, as well as the pediatric residents now during the advocacy rotation starting in March.
This is an example of the HEAL curriculum syllabus, the Health and English Literacy class program. And as you can see, during the course of a month or two, they review lessons on healthy eating, medicine, emergencies, appointments. They teach our patients how to talk to the doctor, what their health is, and then they do a mock conference where they can practice some of the skills that were learned in this program.
In the about the workshops with the family, this is an effort that we're putting together, starting for this spring and also on the fall. We're going to start March 5th. We're going to do these workshops on Thursday, 6 p.m. to 7:30 p.m., and it's going to pilot in the main library in Jefferson Street. We have to thank Carilion Children's Foundation for giving us a grant to actually develop this program. So right here we have the spring schedule. We're going to start March 5th with child nutrition. Then we're going to do family fitness, sleep, dental. For April we have feelings and tantrums, learning challenges, ADHD, anxiety, and depression. And then in May we're going to do preventing substance abuse and building connections. We are very lucky to say we have had a lot of people from the community very excited about helping us to make these workshops fun, and we are happy to actually feed them a dinner. And our plan, this is like a little how the template is going to work. We're going to start with a little bit of meaningfulness, and then we do a free healthy dinner that our nutritionists help us, Ms. Patel, help us put it together, and we have 10 to 15 minutes subject talks, and then we have activities that they're going to do, music, arts, and craft, and yoga, dancing, and then we're going to have a summary of the activity, a take-home message, and 1 minute of safety, and the book to take home. So, for example, for our activity for March 5th, we have planned a gratitude. So giving thanks for the first 3 minutes. Lupita's Tacos is feeding us tacos with a 3-bean salad. The talk is going to be about nutrition, and it's focused on my plate. Dr. Hayes, which is a resident on the advocacy rotation, and Ms. Lakshmi Patel help us put that together. The song is called Brain, and it's Joy Neron who's going to sing for us. The YMCA is helping us making guacamole and fruit salad, and they're going to craft my plate. And then we're going to put together all my plates and answer their questions and share their arts. And we have 1 minute safety point about poison control, and they're going to get the poison control magnet to take home, and the book to go home is Good to Eat, a kid's guide to food and nutrition.
So how can you help? If you have any patients that need to be plugged into insurance or a medical home, or if you have patients that have food insecurity, please send them to the main library on Wednesdays, 10:30 a.m. to 1 p.m., or to our office at Jefferson Plaza on Thursdays, 8 a.m. to 11:30 a.m. And remember, this is not just restricted to pediatric patients. This actually is opened up to all of your adult patients and their families, as well as it's not restricted to just insurance or food insecurity. Anything that DSS can do to help, they've actually opened it up for those dates. Also, for our health literacy branch, if you could email either Dr. Jaimes or myself any resources that you think would be good for your patients, that you would want the library to buy so that the patients can go to the libraries and borrow them, please let us know. And also, please refer any patients that you think would benefit from English as a second language classes, citizenship classes, or the health literacy education program that Blue Ridge Literacy does. You can refer them directly to Blue Ridge Literacy. And then also, if you can invite your families to the health education workshops that we are planning on Thursdays from 6 to 7:30 at our main library as a pilot, we would appreciate it.
And if you want to help with any talk, or you know about anybody who will be great with kids and can make this fun for us, please contact them with us. If you think about subjects that you think we must discuss during these workshops, also talk to us. We are already planning for the fall schedule. Thank you very much for listening to us. And if you have questions, concerns, or suggestions, please don't hesitate to contact us through our emails, probably the easiest way.